Hey, good evening. We're going to go ahead and get started. Thank you for joining us this evening. We hope that you will find this to be valuable. We're going to spend some time talking about Medicare. There's a lot that goes into Medicare, and if you or someone in your family is approaching the age of 65, you're getting to Medicare, you're trying to determine if you're going to continue working or not. There's a lot of moving parts that go into this. So we're going to spend some time tonight going over, doing a high view, talking about the various parts of Medicare, things that you should consider. If you have specific questions, you can go ahead and put them into the Q&A. You'll see that bar at the bottom of the box. So you can go ahead and type them in there and we'll do our best to answer all the questions. Everybody's situation is unique. So if there's a specific situation that you have, what I would encourage you to do is we will have contact information at the end of this presentation. You can set up a one-on-one with one of our Medicare reps. We have Kathy Thompson, who's going to do the presentation, Paula Vinay Condenning as well on our team. They have many years of experience in Medicare working with the local carriers, so they can help you through and talk to you about your specific needs. So with that, I'm going to hand it over to Kathy, and she's going to lead us through the deck.
Good evening, everyone. Welcome, and thank you for your patience. We were running into a few little technical glitches. We're glad you're here. The presentation you're going to see may have some numbers that are slightly out of date, but I can give you updated numbers. And as Kim had mentioned, we encourage people who have more specific questions related to their own situation to please contact us, and our information will be at the end of the presentation. So we call this Medicare Basics, and we do cover a great deal of information. I'll just say a little bit about me. I have been with Welsh Duffield, specifically brought on board to assist employees who are in exactly your situation. Either you or someone in your family may be approaching the Medicare eligibility point in life, and we have a lot of consults that we do and a lot of presentations within the employer group arena. But we usually do the presentations during the day, and we thought that we would do this in order to give you some after hours access to the information that we share in a general way. So we'll get going. So to start with, the definition of Medicare and who is actually eligible for it is anyone turning 65, and also those who are eligible through disability. This is actually the table of contents. Sorry, I'm getting started a little ahead of myself. We're going to talk about how Medicare works. And we're talking also about how you might apply for Medicare. We're going to leave the Q&A till the end. As Kim said, the Q&A box is a great place to put your questions, and we'll make sure that we get to everything. And here is our originally assigned presenter, my colleague, Paula Vinay Condenning, who's been in this business for 10 years, and we have worked together for many of those years. And so she's been with us a couple years now at Welsh Duffield, and I'm going to turn this over to her.
All right, a couple of things. The information in this presentation, by and large, is applicable to the entire country. If we do have anybody joining us from out of state, I will try to mention those points where it's strictly a New York, Western New York thing, but in general, the information that you're going to be seeing is good across the board. So The federal government, Social Security, is the place where you are going to apply for Medicare benefits, or the Railroad Retirement Board if you happen to be, or your spouse is a railroad retiree. The reason why we put this slide in here is very important because unfortunately, when you near Medicare eligibility, and you're probably well aware of this already, you get inundated with mail, postcards and letters and advertisements that try to look really pretty official, but if you look at the fine print, you'll see it says, not affiliated with any government agency. The thing we want to remind you is to keep an eye out for these logos, okay? If you're getting a piece of mail from the Social Security Administration, they're the ones who are actually going to mail your Medicare card to you when you become eligible. They are handling the enrollment into Medicare. So when you actually apply for Medicare, you're doing that through the Social Security website. Once you're enrolled, the Centers for Medicare and Medicaid Services, or CMS, is the agency that regulates the Medicare Advantage plans and puts forth the rules for Medicare. So keep an eye out for these logos. They're very important. And if you ever have a question about a piece of mail that you've received, whether it's legit or not, just let us know. We'll help you. There are 4 parts to Medicare. Part A and Part B are actually administered by the federal government. So Part A is hospital insurance, inpatient hospital, blood while you're in the hospital, hospice care, that falls under Medicare Part A. Part B is your medical insurance. So your doctor visits, your specialists, your MRIs, your blood work, all of those things fall under Medicare Part B. And we're going to dive a little bit deeper into this, but just as an overview, Part A and B of Medicare are administered by the federal government. So when you become Medicare eligible, you're going to get a red, white, and blue card that's going to show effective dates of Part A and Part B of Medicare. Part C, also known as Medicare Advantage, you'll hear this advertised an awful lot, especially during the annual enrollment period from October to December. The insurance carriers are promoting their Medicare Advantage plans, otherwise known as Part C. And Part D, easy to remember, D for drug. With your Medicare Advantage plans, most of the time your drug coverage is built right into them. So where Part A and B are administered by the federal government, Part C and D are offered through your private insurance companies, your Blue Cross Blue Shields, your Aetnas, your Humanas, your Independent Healths. Those are the companies that are administering the Medicare Advantage and the prescription drug coverage. When you have original Medicare Part A, that's covering inpatient services, skilled nursing, hospice, and blood. For most people, there is no cost to Part A because you've been paying into it through your working career, through your FICA taxes. So 10 years of FICA taxes coming out of your paycheck or your spouse's paycheck are going to entitle you to premium-free Medicare Part A. Part B of Medicare, the doctor visits, your outpatient procedures, things like that, there is a cost to it. In 2023, for most people, you pay $164.90 a month for your Part B. If you're collecting Social Security when you enroll in Medicare, that Part B premium just gets taken right out of your Social Security check. If you're not collecting Social Security and you enroll in Medicare Part B, Social Security will actually bill you for that amount quarterly. And little note at the bottom here, and we'll get a little bit deeper into this later in the presentation, if you have earned a higher wage, you may have to pay more for your Medicare Part B. There's something called an income-related monthly adjustment amount, or an IRMA, and we'll get into a little bit deeper into that in a bit. So when you turn 65, you've got a lot to think about. And I think Kathy and I both get the I don't know what to do, I'm so confused call from a lot of folks. And there's things you should take into consideration. First off, you want to figure out if you're going to keep working, or are you considering retiring when you turn 65? You want to examine the type of plan that you're enrolled in with your employer. If you have a high deductible plan, maybe you're contributing to an HSA. This has become sort of a pet project of ours to help educate folks on how Medicare and HSAs work with each other and what the rules are in relation to turning 65 and your ability to contribute to an HSA. Are you covering a spouse or do you have dependent children on your plan? Obviously, you don't want to leave them hanging if you say, hey, I want to go join a Medicare Advantage plan. Of course, you want to take into consideration your own health and prescription needs, your travel needs. Maybe you're looking into becoming a snowbird and you have doctors down in Florida that you want to be able to check in with, or you're somebody who utilizes the Cleveland Clinic for a specialized medical condition. And of course, we're all going to take into account what our own budget is and what our income is, because again, that can affect what you have to pay for your Medicare. The rules are different depending on the size of the employer group that you're with. So we have a lot of folks here from a lot of different groups, and at Walsh Duffield we service both larger employers and smaller down to what we call like micro groups, where there's only a couple people on those plans. So the first couple slides here is discussing larger groups with 20 or more employees. If you are actively working and you're turning 65, you do have to be offered the same coverage as your employees who are not turning 65. You're not required to pick up Medicare A and B, generally speaking. And if you are contributing to an HSA, in particular, we want to steer you away from enrolling into Medicare A or B. You have to be a little bit careful about that conversation with Social Security. We'll talk a little bit more about that. But what you need to keep in mind is if you want to continue contributing to an HSA, you cannot have Medicare A or B. And as long as you are actively working, if there's over 20 employees and you're not collecting Social Security when you turn 65, you really don't have to touch Medicare at that point. Real important, something that kind of comes up a bit, the drug coverage that you have through your employer group needs to be considered creditable. Not credible, it's not believable coverage, it's creditable, which means you get credit for that drug coverage being good or better than the application, than what Medicare requires you to have. So Medicare has standards that they consider creditable coverage to meet. So when you turn 65, your employer should be sending you a letter of creditable coverage every year. Hang on to those letters. It's easy to just look at it and say, oh, I don't need to worry about this, and put it in the circular file. But it is really important once you turn 65 to keep a hold of those letters, because when the time comes that you retire and you decide to join a Medicare drug plan, your insurance carrier is probably going to send you a form to fill out asking about your prior drug coverage. And if you don't have proof that you had creditable drug coverage in the past through an employer, you actually may suffer a late enrollment penalty. And those letters of creditable coverage are your proof that you've had that coverage in place. So just a little flow chart here for your over 20 employee groups. If for some reason you're not covered under your employer plan, of course, when you turn 65 and you get Medicare, you have a bunch of options. You may have a spouse whose plan you can join. You may have other group coverage available to you. Or of course, you can look at going into a Medicare Advantage or Medicare Supplement plan. If you are covered by your employer plan and you're contributing to your HSA, you're going to hear me pound this a few times because it's really important. You cannot have Medicare A or B. So you want to kick that can down the road if you want to keep contributing to your HSA, and you can continue with your employer plan until you decide to retire. If you're not contributing to an HSA, you have the option. You can enroll in Medicare Part A. If you call Social Security and you tell them that you're going to be working, but you're turning 65 and you're not sure what to do, they're going to tell you to pick up Part A because, hey, there's no cost to it. You've been paying into it. I have yet to figure out what Part A is doing for you, except hanging out there and keeping you from being able to contribute to your HSA if you're covered under an employer group and you're over 20. One note I want to put out there as well, I don't know if anybody on our meeting today happens to be Medicare eligible due to a disability. Rules are a bit different if you are actively working disabled and you become entitled to Medicare. The rule about picking up your Medicare A and B, it changes from being actively working for a group over 20 employees. It actually affects groups that are over 100 employees when you have a disability eligibility for Medicare. So when the time comes, when you're ready to retire, you do need to pick up Part A and B of Medicare. Take a look at what Medicare plans are available to you. There are some employer groups that actually offer group Medicare plans, which you may want to compare to doing with what we call a direct pay Medicare Advantage plan. If you are offered COBRA when you retire, you definitely want to check in with us and talk about the rules, because if you're going into COBRA coverage, you do need to pick up your Medicare as well. If you have a spouse or other family members who need coverage when you retire, they may be eligible for Medicare. But what we find quite often is you have, one spouse who's turning 65 and retiring, and the other spouse is not quite there yet. They have a couple of years to go. There are options available either through COBRA or in New York. Of course, we have the New York State Marketplace, which you'll hear advertised on TV. It's the New York State of Health, the official health plan marketplace. I actually work on both ends of the business. So I do Medicare primarily, but I also do the marketplace plan. So if you need assistance for a spouse or, even a child who's turning 26 and losing coverage off your plan, we're certainly available as a resource to help out with that as well. If you're not a New York State resident, your starting point is going to be healthcare.gov. On healthcare.gov, you can type in what state you live in, and they're going to tell you if you can enroll through the federal marketplace or if your individual state has its own exchange. So check into that if you need it. Now, under 20 employees, if you're turning 65, or under 100 employees, if you are becoming Medicare eligible to disability, you need to enroll in Medicare A and B, even if you're going to be actively working. And the reason why is that unlike a group over 20, where the group plan is your primary payer on your claims, when you're under 20 employees, Medicare's supposed to pay first. Okay, so some of the insurance carriers will actually mail you a letter when they see that you're edging in on 65 and asking you to provide your Medicare information so that they can coordinate your benefits, because Medicare is supposed to be the primary payer on your claims. Now, it doesn't mean that you can't stay on your employer plan, but you certainly want to take a look to see if it's advantageous to stay on your employer plan. You're going to lose the ability to contribute to your HSA because you're going to have to enroll in Medicare A and B. Of course, you need to keep in mind those creditable coverage letters as well. Keep a hold of that. Same rules apply whether you're under 20 versus over 20 employees. So a little deeper dive into HSAs. And I'm sure Kathy probably told you at the beginning here, once we wrap up, we are going to be sending an email that's got a flyer that we put together with some HSA education on it, some different scenarios that may apply to you. But in general, money in an HSA, and I'm a big fan of HSAs. I think they're fantastic. I have one myself. Money in an HSA is your money. Okay, so whether or not you continue to contribute to an HSA or you drop off of having an HSA qualified plan, the money that's in your HSA is yours, which you can use for your future medical expenses. It's a great savings vehicle, really. If you wish to contribute to the HSA, here it is again, you can't have Medicare A or B. Be careful when talking to Social Security. They're not going to ask you the questions. They're not going to ask you, well, what size is your employer group? They're going to say you need to enroll in Medicare if you're turning 65. They're not going to ask you if you're contributing to an HSA and you want to keep contributing. The question isn't going to come up. They're going to say, well, you probably should enroll in Medicare A because you might have a penalty later if you don't. So just be careful. I would say talk to us before you talk to Social Security, just so you're clear on the questions that you need to ask them and the information you want to provide to them. Keep in mind, if you are actively working and you are covered under your employer plan, you are not accruing a penalty for not taking your A and B of Medicare. A lot of confusion on this. We get this call all the time. Well, I talked to my cousin and he said that he got a huge penalty because he didn't enroll in Medicare. If you are actively working and covered under your employer plan, there is no penalty for not taking A and B of Medicare. And as long as your creditable coverage letters are coming to you and you know that the drug coverage in your employer plan is creditable, there's no Part D penalty to worry about either. Okay. Special note here about when you enroll in Medicare Part A. So let's say, you're going to keep working. Maybe you're going to retire when you're 70. And you've got your target date in mind. And all along, you've been contributing to your HSA. You haven't enrolled in Medicare A or B, but now you're ready to do that. You need to stop contributing to your HSA 6 months prior to your retirement, because when you pick up Medicare A and B, they automatically backdate your Part A 6 months. Your Part B would go into effect, the first of the month that you're requesting, but the A will backdate, which means that if you put money in there, you're going to have to pull it out or you may face some tax penalties. Now, one question that comes up quite often is, well, if I'm going to be working January to June, can I put in the maximum amount of the year as long as I'm doing it before my Medicare goes into effect? You cannot. You can put in a prorated amount. So if you're involved in the HSA contributions for 6 months, the first 6 months of the year, you can contribute the maximum amount divided by 6. So per month, they do prorate that. That makes sense. This slide just going over the contribution limits for 2022 and 2023. A nice advantage if you're over the age of 55, you can actually put in an additional $1,000 towards your maximum contribution for the year. They call it a catch-up contribution, so you can maximize your bang there for your buck with your HSA over the age of 55. All right, this slide looks familiar. Okay, just to recap, Part A, hospital insurance, Part B, medical insurance, managed by the federal government. Part C, Medicare Advantage plan, interchangeable term, usually includes your Part D, D for drug. Those are offered through your private insurance companies. So if you enroll in Medicare Part A and B, and you just have your red, white, and blue card, there are a lot of holes in original Medicare. So I've mentioned that for most people, you don't pay a premium for your Part A of Medicare because you've been paying into it your working career. However, if you wound up getting admitted to the hospital, you have a $1,600 deductible in 2023 before Medicare starts paying anything on your hospital bill. If you got discharged and went back in after 60 days has lapsed, you're starting a new benefit period and that $1,600 starts over again. So it can really hit you for quite a bit of money with just original Medicare Part A. Your Part B of Medicare, remember those are your outpatient services. Under this, you would also find things like radiation therapy, kidney dialysis, chemotherapy, oral chemotherapy, infusions, Remicade infusions, things like that. That's all under Part B of Medicare. And if you're just out there with original Medicare Part B, For most people, you're paying $164.90 a month. You have a one-time deductible of $226 before Medicare starts paying, and Medicare is going to pay 80% of your costs. 20% of your medical cost is on you, and there's no cap. So, God forbid, you do get the bad diagnosis where you're having infusion therapies or chemotherapy, things like that. It's 20% out of your pocket if you just have original Medicare Part B. Even if, something minor happened and, you twisted your knee and you had to go for an MRI and physical therapy, again, 20% everything you're doing, it can really add up on you. Additional costs, if for some reason you retired, or let's say you had a New York State Marketplace plan and you didn't pick up your Medicare Part B, you're accruing a late enrollment penalty of 10% on top of that Medicare Part B premium for every 12 months you go without Part B. It can be waived if you have a low income. And keep in mind, there is no penalty as long as you are actively working and covered under an employer plan, whether it's your own plan or your spouse's plan who's actively working. The IRMA, the Income-Related Monthly Adjustment Amount. This is assessed to folks with a higher income. You'll see the little example here. So it's based on your income from 2 years ago. Okay, so when you're applying for your Medicare Part B, they're looking at your 2021 income this year to determine if you have to pay an IRMA. So if you're a single taxpayer and you make over $97,000 in 2021, in 2023, instead of paying $164.90, you're going to pay $230.80 for your Part B. Now, if you are in a situation, and this happens quite often, where your income in 2023 is going to look a heck of a lot different than it did in 2021 because you're retiring and you're not going to have that income anymore. There is an appeal form that you can submit to Social Security to ask them to reconsider your Part B IRMA because you had a life change event, such as a loss of your income from your job with a retirement. And we have those forms and we can talk you through it. So, as you can see, a lot of holes in original Medicare. So what do you do to fill in those things that original Medicare doesn't do for you? Two main options really when you're pulling out of your employer coverage. Part one, you can stick with original Medicare A and B as your primary insurance and pick up what's called a Medicare supplement plan. You'll also hear it referred to as Medigap. With that, of course, you're going to pay your Part B premium, and then you will also pay a premium for your Medigap coverage. With that, there is no drug coverage. Okay, so the Medigap plan fills in the gaps of original Medicare A and B, but you also have to pick up a standalone drug plan to accompany that. Okay, so that's can get a little costly, and we'll dive a little deeper into what those potential costs could be. Your second option is the Medicare Advantage plan, otherwise known as Medicare Part C. With a Medicare Part C, the insurance, so let's say you enroll into a Highmark Blue Cross Blue Shield Medicare Advantage plan, that is your primary insurance. You have to have Medicare A and B to be eligible to enroll in Medicare Part C, but the C, the Medicare Advantage plan, becomes an umbrella over your A, your B, and most of the time those plans include your D, so everything's under one umbrella. In Western New York, particularly, we see most people really gravitate toward the Medicare Advantage plans. So with a Medicare Advantage plan, they do have to be approved by Medicare every year. So actually, the insurance companies right now are working on their bid for what their Medicare Advantage plans are going to look like for 2024. They submit those to CMS, remember the Centers for Medicare and Medicaid Services, and they have to be approved by CMS before they can offer them to the public. They have to cover everything that Medicare Part A and Part B cover, and you have to have Part A and B in order to enroll in them. Now, we talked about the deductibles and the co-insurances on Medicare, original Medicare. If you enroll in a Medicare Advantage plan, those costs go away and you're just responsible for the copays or the coinsurance on your plan, on your Medicare Advantage plan. The neat thing about the Medicare Advantage plans is they build in a lot of bells and whistles. So you have things like gym memberships and over-the-counter catalogs to order like vitamins and first aid kits out of. You have a lot of times hearing benefits, dental, preventive and comprehensive dental sometimes built right into those plans, vision benefits. So there's a lot of really nice comprehensive wellness and benefits packed into those plans. And you have a choice of doing an HMO plan. So with an HMO, that's a health maintenance organization. And don't think about it like it was in the 80s where, oh God, if I'm in an HMO, I need a referral to do everything. It doesn't work that way anymore. So with an HMO plan, as long as you're sticking with the network of doctors in your service area, so for example, the 8 counties of Western New York, you are just paying your copay as you go along, and then you'll have worldwide coverage most of the time for an emergency or for urgent care if you're traveling. With a PPO plan, that's a preferred provider organization, a PPO plan actually has a local network of doctors too, but it gives you an expanded ability to see doctors outside of the network, usually at a higher copay. But with a PPO Medicare Advantage plan, you can see any doctor across the country that accepts Medicare. So it gives you a lot more flexibility if you are somebody who needs to utilize Cleveland Clinic, or again, if you're a snowbird, that can be a good fit. Usually your drug coverage is built in. There are some Medicare Advantage plans that don't include drug coverage, which can be a good fit if you're somebody who perhaps gets your prescriptions through the VA. There are some really nice Medicare Advantage plans that have no drug coverage that are specifically designed for veterans. Some really nice benefits in there. And if that applies to you, we can certainly take a look at those options. There are certain times of the year when you can enroll in a Medicare Advantage plan. I mentioned the annual enrollment period that runs every year from October 15th till December 7th. But if you're in a circumstance where you're just becoming newly eligible for Medicare, you have a window of opportunity based on the fact that you are aging in, or if you are retiring and losing your employer coverage, that opens a window of opportunity for you as well. So certain times of the year, a lot of special circumstances that give you the ability to change your plan or enroll newly into a Medicare Advantage plan. And the costs can really vary. You hear a lot of advertising about the zero premium plans, and you think, oh my gosh, how can it be zero? What am I missing here? Well, no premium to you, but remember, you're paying $164.90 a month out of your Social Security for your Part B. So when you enroll in a Medicare Advantage plan, basically the federal government is subsidizing the insurance companies to administer your benefits so that they don't have to do it. So a good portion of that $164.90 is going to the insurance companies to take care of you. And of course, the premium can go up if you go into a plan that has the PPO coverage, for example, or if you're paying more upfront, you're lowering your copays as you use your insurance. So if you're somebody who's a higher utilizer of your insurance, sometimes it makes sense to go into a higher premium plan. Financially, overall, you might come out to the good. The Medicare prescription coverage, whether it's built into the Medicare Advantage plan or you're doing a supplement plan and picking up a standalone Part D plan, again, offered through private insurance companies and approved by Medicare. With Medicare drug coverage, you have to have at least one part of Medicare to enroll. So Medicare Part A and or Part B. Those plans have to meet the Medicare standard benefit, and they have formularies. Of course, that's your list of covered drugs and different tiers. A little different on Medicare versus what you're probably used to with your employer. A lot of employer plans have a 3-tier drug formulary. You've got your generics, your brand names, and your specialty. Most of your Medicare Advantage plans or your Medicare Part D plan standalone will have a 5-tier formulary. So it's very important when it comes time to pick your plan. We always ask if you have a list of your current medications, because we can run those through a calculator and tell you what you're going to anticipate cost-wise, because it is a bit different with Medicare versus being on an employer plan. And honestly, sometimes that's what sways you one way or the other, if it's better to join a Medicare Advantage plan or to stick with a retiree plan or an employer group Medicare Advantage plan. And again, with the Part D, your costs really can range from as little as around $10 a month up to over $100 a month. Now, remember we talked about that Part B IRMA, the income related monthly adjustment amount? Surprise, you have a Part D IRMA as well. So unfortunately, when you've done well and you've earned quite a bit of money, they're going to get you on the Part B premium and also on your Part D. You may have to pay a little more for your drug coverage if you're a higher wage earner. We've got all kinds of charts we can go through with you if that is your situation, and kind of help you figure out what you're really going to be looking at cost-wise. Difference with a Medicare Advantage plan versus the Medicare Supplement plan or the Medigap plans. With those plans, Medicare remains your primary insurance. So if you're going to a doctor, going to the hospital, you're showing both your red, white, and blue Medicare card and your plan card from the private insurance company. Medicare pays first, the insurance fills in the gaps. The interesting thing with a Medigap plan is in all but 3 states, the benefits on the Medigap plans are standardized by the federal government. So if you lived here or you lived in Florida and you went into a Medigap Plan G, let's say, the benefits are exactly the same. The plan designs are the same. They're going to cover the same things. The only difference is going to be the premium and who you feel comfortable doing business with. And within Western New York, there are many companies to choose from for a Medigap plan, but the premium can really vary from company to company for exactly the same coverage. So you want to do a little research before you dive into that if the Medigap plan is going to be the route you take. The other thing with Medigap or the Medicare Supplement plan is you don't have a provider network. So with Medicare and the supplement, you can see any doctor that accepts Medicare. Now, they don't include the bells and whistles that the Medicare Advantage plans do. So you don't have, the gym membership and the eyeglasses and the dental and that sort of thing. And they don't have your drug coverage. So again, you have to pick up the standalone prescription plan to accompany the Medigap. And the cost, when I say there's a wide variety of costs, I mean there's a wide variety of costs. And the Medigap Plan A, may only cover a very little bit of your gap in original Medicare, where a Plan G is more of your kind of Cadillac of plans, where your only out of pocket is the Part B deductible of $226. And after that, that plan is filling in everything, all that 20% co-insurance. So there really is a wide range of options. And not every insurance company that offers Medigap offers the same Medigap plans. So you may do a little research and you think, oh, well, I think the Medigap C sounds pretty good. Well, you may not be able to enroll in it. Different rules. So work with us if that's the route you want to take. We'll figure out, which company offers the plan that you want and what plan is the right fit for your needs. So this is just a little side-by-side comparison of the differences between Medicare Advantage and Medigap. I think I've gone through that pretty thoroughly. So moving along, when it is time to apply for Medicare, the process is different depending if you're collecting Social Security or not. If you are collecting Social Security, about 3 months before you turn 65, a packet is going to magically arrive in the mail telling you to get ready for Medicare, because you are automatically enrolled in Medicare A and B. So your Medicare card is going to be in there. Now, if you're going to keep working and you don't want to pay $164.90 a month, there will be instructions with your Medicare card on how to mail it back to Social Security and decline your Part B. Okay, you're going to have Part A. But again, there's no cost to it. But if you are actively working and you want to turn off that Part B because you're in a larger employer group and you don't need the Medicare Part B, there will be instructions on how to send that back. Again, keep an eye out for a packet with the Social Security return address logo. Can't tell you how many people have gotten a packet in the mail and just thrown it away because they didn't know what it was and they weren't really paying attention, because otherwise, it's a kind of a plain looking package, but the Social Security return address is going to be there. This is what your Medicare card looks like. Up until a few years ago, your Medicare number used to be your Social Security number or your spouse's Social Security number with a letter after it. But in the effort to keep everybody secure and try to eliminate identity theft, they actually changed this over to a random series of letters and numbers. And you'll see your Medicare Part A, your Medicare Part B are going to be listed on that card. If you decline your Part B and you mail it back to Social Security, they will actually turn around and mail you a new card just showing your Part A. Now, in general, if you're enrolled in a Medicare Advantage plan, you do not have to carry this card around with you because your Medicare Advantage plan is your primary insurance. And you'll notice when you get this in the mail, it's put on really flimsy paper. So easy to rip. So probably not in your best interest to carry it around in your wallet. Just tuck it away someplace safe. Really, the only time you'll need that card is if you're enrolling into a different Medicare Advantage plan. Now, again, if you have a supplement plan, a Medigap plan, you're going to have to show both your Medicare card and your insurance card. So you may want to find a protective sleeve for it or perhaps laminate it so it doesn't get torn. If you're not automatically enrolled in Medicare, whether you kicked that can down the road and you're suddenly ready to retire and pick up your Medicare benefits, or if you're working for a smaller employer and not collecting Social Security and you need to actively apply for your Medicare, pretty easy to do it on the Medicare on the Social Security website, ssa.gov. Right on the home page, right in the middle, it says apply for Medicare. And you'll create a My Social Security account. Takes most people, I'd say, anywhere between about 15 to 20 minutes to enroll in your A and B of Medicare. Takes our friends at the federal government several weeks to process it, but you can kind of keep an eye on it through your My Social Security account. Of course, you can enroll over the phone. If you're going to do that, be prepared. If you call to make a phone appointment, you're going to be waiting. Number one, you're going to be waiting to talk to somebody on the phone for a while. And number two, your appointment is probably going to be several weeks to a month or so away from the time that you call. Or you can make an appointment at your local Social Security office as well. And if you need any contact information for, what Social Security office is yours, if you need a phone number, fax number, we have that information available. This is just a little highlight of what the online application looks like. It's teeny tiny, but it's just a few simple steps to log in and apply for your Medicare benefits. And this does not, even though you're doing it through the Social Security website, this is not enrolling you into Social Security benefits. It's going to ask you a couple of times, are you just applying for Medicare? You're fine. If you picked up Medicare Part A while you were working and you only need to apply for Part B when you retire, the process is a little bit different. There are actually two forms that need to be completed to apply for your Medicare Part B. The first form, the application for enrollment in Part B, is for you to complete. And the second form, the request for employment information, you'll fill in the top section and your employer, your HR department, will fill out the bottom. So the application for enrollment in Part B, one thing I want you to keep in mind when you have that form, and if you need them, we have them, we can email them to you or send them out. There is a section in there called the remarks section, section 12. In that remarks section, I highly urge you to put your requested effective date of your Part B in that remarks section. So we usually guide you to give yourself about 60 days of lead time. So let's say, okay, I want to retire at the end of the year. I want my Medicare Part B to go into effect for January 1st. I'd say get that ball rolling in the beginning of November. But when you submit that application, you want to put in the remarks section, requested effective date January 1st, because if for some reason Social Security is really on top of their game and they process that quickly, if you don't indicate when you want your Part B to go into effect, they're going to give you the first available effective date. So give yourself 60 days, but put in the remarks section when you want your Part B to go into effect. On the request for employment information, this is basically proof that you have had employer coverage since you turned 65 and avoiding a Medicare late enrollment penalty for the Part B. Okay, very important that you submit both of these forms together. You can either drop them off at the Social Security office, you can fax them in. I would not really recommend trying to mail it to the federal government. I think dropping it off in person or faxing it over is probably the better way to go. It can take several weeks for Medicare to process this. And just a little reminder, if for some reason after you turned 65, you changed jobs, your current employer is only going to be able to attest to the fact that you've had that employer coverage, let's say from the time you were 68 until you were 70. You may need to go back to a previous employer from when you turned 65 and get an additional request for employment information proving that you've had coverage from that employer from age 65 to 68. As of 2020, thank you, COVID, these plans you can enroll online for your Part B. And here's the thing, it's available. You can do it. I actually, as much as I love technology, excusing what happened earlier when my Wi-Fi went down, but I find the paper applications is actually an easier way to go than actually doing this online, because you may have to upload documents from your employer and things like that, and that can sometimes be a real pain. So my advice, if you can, just do the paper. I think you'll find it a bit easier to do. So Kathy and I are here to help. I have thrown a lot of information at you and your head might be swimming right now. If you need help, even if you're going to keep working and you just need to confirm that you're doing the right thing with Social Security, or if you are ready to retire or you want to explore your Medicare Advantage options or your Medicare supplement options, give us a call about 2 to 3 months before you need the coverage. Okay, so we can talk through that Part B application, or we can talk about, your target date for retirement. We will work with you one-on-one. There is absolutely no cost to you. Whether your company is a Walsh Duffield client, or for heaven's sakes, if you know your mom or dad or a relative could really benefit from working with us, there's no cost to use us. Okay, so don't hesitate to share our contact information if you know somebody else who could use a hand with this nonsense. We will provide you the information that you need to make an informed decision for what plan, what option, what route is right for you and your needs. We provide, if this is something that would be useful to you, it's useful to us, a plan assessment, which just helps us to capture kind of your basic information. Are you a snowbird? When is your Medicare going into effect? Who are the doctors you're seeing? What prescriptions are you taking? This is our kind of jumping off point where we can start doing some homework for you and narrowing down what plans we feel might be the best fit for your needs. There are a lot of plans out there, so it can get pretty confusing, and you're probably going to be getting mail and emails and even phone calls from your current insurance carrier saying, hey, we've got a Medicare plan for you. The benefit of working with Kathy and I is that we are impartial. We can show you a wide variety of plans from a wide variety of carriers, so you can really make sure that you're getting something that's right for you and not just, well, I know this carrier, so I'm just going to stick with them. It really pays to take a look, because you may be missing out on benefits that you didn't even know were out there. And again, we can meet with you in a variety of different ways. So I always tell people I'm very portable. So tomorrow I'm driving down to Jamestown to meet up with a client. I live in Niagara Falls. It's fine. It's all good. We can meet with you over the phone. We can do virtual meetings just as we are chatting today, or we can do one-on-one appointments. We have an office, of course, in downtown Buffalo, right on the corner of Main and Goodell. We have a nice private conference room there we can talk, or we can meet out, you know, at the local Tim Hortons or Panera's, or even come out to your house if that's more convenient as well. Very flexible. This is a sampling of the carriers that we work with. One thing we have to tell you every time we meet with you is that this is a new CMS blurb that we have to read through. So when you call us or email us, just forgive us. We have to do this, and we have to tell you that we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all of your options. You'll hear that probably every time you talk to us. And when you do call us, or if we call you, just know that we are on recorded phone lines as is required by Medicare, and they do that for your protection. So you'll see a wide variety of plans that we can talk to you about. You'll see in Western New York, again, this is Western New York, you've got kind of your big three, your Highmark Blue Cross Blue Shield, Independent Health, and Univera. Walsh Duffield is actually one of the very few brokers in Western New York that is contracted to offer independent health plans. So that's a real feather in our cap, I think, that we can do with that. They only work with a select number of brokers. This is us, Kathy, who did our intro. Kathy, the reason that I work at Walsh Duffield, thank goodness. And that's me, Paula Vinay Clendenning. My husband is still wondering why I hyphenated, because the last name is a little clunky, but it's okay. And our general office hours there. Just some other resources. Again, the Social Security website to apply for your Medicare benefits. The Medicare.gov website, I've got to say, for a government website, I really like Medicare.gov. There's a lot of really good information on there. So if you haven't checked it out before, go there. If you have questions about, you know, rules for different employers and you know what costs are for original Medicare, you're just not retaining all of that, Medicare.gov has a lot of good resources. And then Epic in New York State, we're very fortunate that we have a state pharmacy assistance program called Epic, one of the few states that still offers such a thing. And it can be a real helper to have in your back pocket to assist with your prescription needs. So we put that information there as well. All right, I've done a lot of talking. Kathy has been keeping an eye on our Q&A, so I turn it over to you, my friend, while I take a sip of my water.
Please do. Okay, I'm going to skip to the second one I have here, and thanks, Paula, for that really informative and comprehensive presentation. One of the things we didn't cover in the intro while we were kind of working around the technical glitches was, yes, we will be sharing, this is a recorded conversation. We will be sending all attendees a copy of the recording and a link, and the presentation slides, which have all this great information in them. So we have planned to send that out. Another question I have here is, can you get past creditable letters from years past from your employer? So, yeah,
hopefully.
Hopefully, usually employers are helpful. The HR departments are helpful in getting you whatever information, whether it's a single letter for you or, you know, past individual creditable coverage letters for each year. Let's see. Are you going to email this presentation? Yes.
Yes. And not just the presentation, we'll also have the flyer regarding HSAs and Medicare attached to that, and I believe our consultation flyer again that just kind of details our services.
And here's something that echoes what I just said. Best presentation on this subject I have seen. So compliments to the presenter.
Thanks.
Yeah, absolutely.
That's why I have all these books behind me. You know, I'm very.
Yes,
Do a lot of
right.
reading about Medicare.
Yes. I have another one here. I don't have any prescriptions that I take. Can I just skip Part D coverage for now?
That's such a good question. I wouldn't. And here's the reason why. For every month that you go without creditable prescription drug coverage, you are actually accruing a penalty in the background. So if you drop out of your employer coverage and you decide you really like this Medicare Advantage plan with no drug coverage, at whatever moment down the road, you could be in your 80s and suddenly you do need prescriptions. Once you turn that switch on and enroll in a Medicare prescription drug plan, you are going to be assessed a late enrollment penalty for every month that you went without prescription drug coverage when you became eligible to join a prescription plan. And that penalty will follow you for the rest of your life. So I wouldn't recommend it.
We have a very good one here on HSA, Paula. This is exactly why we've done the flyer that we've done. I am still working. I contribute to an HSA, and he goes on to describe the plan. The point being, I already enrolled in Part A, effective date 10/1/18.
Okay.
As I didn't know about the HSA exclusion. What do I do now? And that's been in the force for a while.
Yeah. So am I to understand that you were contributing to the HSA while you had Medicare Part A?
It sounds like that's what.
Yeah. So
saying.
unfortunately, at some point here, you're going to be assessed a tax penalty for those contributions. If it were a little bit closer time period, you could probably back out those contributions without too much of a problem. But I would have a conversation with your tax preparer and see what that might hit you with. I'm really kind of surprised it hasn't caught up with you yet.
Yeah. Yeah. I would say also that you could talk with your HR folks and see if they could at least back out the last 6 months or something along
as
those
much
lines.
as you can. Yeah, I agree.
They may be able to help you that way and take some of it, back some of it out to help you with the size of any penalty when and if the IRS catches up with you.
Yeah, I mean, HSAs are great. They're becoming more and more popular, but the rules are, something that it's surprising how many people are not, and employer groups aren't really up to speed on what those rules are. And it just seems like the snowball is gathering momentum with every time we talk about HSAs, we're getting more questions. So we're really, really trying to help make sure you don't, get stuck in any kind of a pitfall there.
Right. And here's one more. What if I'm on an Obamacare plan when I turn 65, I'm not working, and I want to stay on that? Can't I refuse Medicare?
You can't refuse Medicare. Okay. You have to enroll in Medicare A and B. But if you had an existing marketplace plan and you pick up Medicare Part A and B, you can keep your marketplace plan. However, you will lose any advanced premium tax credit that you receive, and you cannot change your plan. I've seen this in some really specific circumstances when people are dealing with a particular health or drug need, where the marketplace plan, even though they have to pay quite a bit for it because they've lost their tax credit, it's worth it to them to keep with that coverage. So you can't have any Medicare, A or B and join a marketplace plan. Can't do that. But if you are already in the marketplace and you turn 65, you can keep your marketplace plan. You have to pick up A and B because Medicare is your primary payer, and you will lose any kind of an advanced premium tax credits. You'll be paying the full boat. It is not generally the preferable way to go when you have those low cost Medicare Advantage plans. But as I said, in some really specific circumstances, that has worked out to the client's benefit to do.
Right. Thank you for that. Because that is a bit of a complex situation too, and one that's
It
not
is.
well understood. I have, actually, this was our first question and the person missed the answer. So it was just about whether his employer can get creditable coverage letters from past years if he didn't save them. And what we
Okay.
had said was, I would definitely ask HR, and in
Mhm.
most situations we've seen, they're willing to work with you with either giving you a letter, a single letter explaining your coverage dates, or
Mhm.
you know,
Hopefully, maybe they have a
reissue
file of
the
them they can
creditable
reissue.
coverage
Yeah.
letters. Yeah. So that shouldn't be a problem. Looks like we are out of questions. Any
All right.
last minute ones, feel free to type them in there. Thanks to those of you who have participated with by submitting questions and so forth. Please, as Paula said, if you have additional questions or you'd like to connect with Paula or I, use that contact information at the end of the presentation. And again, we will be sending that out for us to consult with you on your individual situation. We're
Everybody's
available.
different, so
Yeah, and
it's worth it.
every single day for as many people as she and I have seen collectively over the years. We're always coming up with new situations. So that's what we're here for, and it is all complimentary. So
Yes.
we're
We
happy
enjoy it, so there's that
yes,
too.
yes, we are
We have a
those
good
people.
we have a good time.
We do.
All right.
We do.
Thank you, everybody, for joining us and for your patience at the beginning. Thank you, Kathy, and we're here to help.